Welcome to our second episode of Family Practice. Last time we talked a lot about pediatrics, but this time we're going to talk about something we all experience, and that is aging. My first guest this evening is Dr. Joe Gerhardstein, known to his patients as Dr. Joe, and one of my partners at Family Practice. Welcome, Dr. Joe.
Good evening, Joe.
You know, I see a lot of patients, I'm sure you do too, the kids bring their parents in, and one of the big questions they have is, do I take the car keys away?
Well, unfortunately, as we get older, things don't work just as well as they used to. Our hair grows a bit grayer, some faster than others.
Yeah,
our hearing
really.
might not be as good. Our vision's not as good. Our reflexes aren't as good. And it's a real difficult thing. Some patients don't even like for their kids to come in with the doctors. They take a little offense to that.
Are there some clues, though, when you might want to take the keys away?
Well, you know, some of the things you want to avoid is when somebody gets lost. You know, you get a phone call, mom and dad's lost. You see some dings in the car, maybe the rearview mirrors or side view mirror's been knocked off. That's a sign that we need to take a little bit more interest.
And one of the things that's hard about that is when you take car keys away, you take away independence.
And these older people have been independent all their life long. As I said before, they regret even sometimes the kids coming in with them. I usually do a little thing to break the ice. I say, well, you remember when you took your son in to get his shots and he didn't want to get them, but he got them anyway. Well, it's the same thing now. Your kids are here to take care of you, and you can't say no.
There are some resources out there, organizations that can help in terms of aging or just informational.
American Association of Family Practice has got a web page. They deal with things. Of course, AARP, retired patients, also have some sources that you can do to look at to help resolve some of the questions.
Now, one of the things that I experience, because I'm getting a little older, my parents experience is arthritis. Their joints hurt, they don't work. Are there things they can do to help with that?
Well, the first thing you have to do is exercise. I know it hurts to exercise because you got neck pain and shoulder pain and knee pain. And what happens, they tend to move less because it hurts more. But it's real important to keep them active, keep them moving. As far as medication, probably the safest thing out there is good old-fashioned acetaminophen.
Well, now, when the joints hurt, sometimes you don't walk as well, you're not as balanced as well, and falls become a risk.
Big risk, especially as we get older. You know, we talked about the visual problems, balance problems, arthritis problems. Sometimes they have back problems. That can cause some weakness in the legs, much more at risk to having a fall.
And falls can, be a catastrophic, especially if you break a hip.
Well, unfortunately, a lot of people get older, the bones get weak, and then you fall and you break something.